Muslims, Christian, Jews, we all work together as one community. That really does help. What I'm going to say, Congressman Frank Plone, for thank you very much for joining this thing. We're going to have this continually. We're going to have every week until this crisis is over. And this is a grave situation right now our community is facing. And we have one of Sabina Mahmood. She does a lot of work for the community. Sabina, you have any question?
Yes, actually, I just wanted to ask, and this can go to Nancy or Deborah. Um, I know that there's other cash assistance programs available besides the stimulus fund that's coming to everyone. I believe a lot of people have received it. A lot of people have not received it, and there's a little, they're getting a little confused on whether they'll get it or not. And I know those questions are available online. My question here is those who are facing enormous financial issues right now, are those programs taking place, such as SNAP and the cash assistance programs? And are people able to access those? Do those still have funds available for people? I know that a lot of people, of course, are passing away. So funeral services, where can they go for all these other assistances that are needed at this time? Thank you.
Yes, who wants to take that question?
Nancy, do you want to start? Do you want me to? Oh,
well,
okay.
I could say the SNAP program, is a federal program, and that's still available. We've actually provided a significant amount of money for the SNAP program. So, if you want more details about that, there's an income eligibility for SNAP. We used to call it food stamps, but it's the same thing. And also, we provided a lot more funding for food banks as well. So if people want to learn more about the SNAP program and how they're eligible for that, they can contact my office, Sam, or they can go on my website and they can get information on SNAP eligibility. I don't think we've changed the eligibility requirements for SNAP, though, but a lot more people probably fall into it because they've lost their job or their income has been reduced, and we provided significant more money for it. But I don't think the eligibility for it has changed. It's still income-based. But you may fall into that category now because you've lost your job or your income's being reduced.
Right. There is, people can go to food banks. Also, there are a lot of food banks providing food. There is one issue with the SNAP in that you can't shop online with SNAP. So if you can't get out to the store because you're ill or because you just can't drive or, whatever reason, there's really not a way to purchase anything electronically. It's something that the Department of Human Services is looking at, but the computers just have never been set up for that. So that's something that they're looking at. As far as the burials, I don't know of any service to get free burials. We have like Potter's Field, for people to be buried, but I don't know of any funding source. I can look into that. I had looked into it once before but it's certainly a good issue, and we have so many deaths that I'm sure it's very relevant right now.
And can I just say, Sabina, I can tell you in Middlesex, but it's certainly, I know, probably available in all the counties, but if people go to Middlesex County, nj.gov, we've created a portal that leads you into just COVID-related issues, and some of it relates to social service issues. So if people need to apply for benefits that they've never applied to before, people who are already receiving those benefits have questions, they can receive guidance and information on how to do things. One of the other things I will say to you is, Nancy was just talking about if you can't leave your home, but I know in Middlesex County, in just about every single one of the towns, there have been amazing efforts made, and there are different groups coming together, and I know that there are from churches and mosques and temples, along with other social groups. We're making great efforts in most of the towns so that we can take care of our neighbors. So one of the things I know is that our South Asian communities aren't so used to asking for help, right, outside of the direct community. But I would encourage people to contact their local municipalities, because all the towns have lists of different groups that are working together to help make up any deficiencies that people are having right now during this crisis when it comes to things like food, especially food insecurity. I know that in a lot of the towns, the school systems are delivering food to the children. And in my hometown of North Brunswick, it's not just the children, it's for the parents too. So if people show up, there will be breakfast, lunch, and dinner for the kids, and then the parents can get food as well, and also at the local food banks. Middlesex County has a large food bank, which we then supplement. It's called McFoods, and then we supplement all of the food banks throughout the county. So there are things available. I wish I could say that that all of the government programs are flush and full of money and resources, but they're not right now. And so where we can, local charities and local social groups are helping to fill the void.
Yeah, and I would say, as Congressman Pallone said, call any of our offices, even though they're not physically open. People are answering the calls every day, and we have a whole list of resources, and we'll talk, connect you wherever it is that you need to go, whether it's the county or the state. And we have calls all along with each other just to kind of update on what's happening. Same thing for unemployment, same thing for any of the federal benefits. And a lot of the business associations have been having really great conferences on and helping people with how to apply for any of the aid that is available. And Mick,
Thank you very much.
The governor's site also, a COVID-19 site, is a very good site that has a lot of information as well. And it also has a wizard, like for business funding, you can go in there and plug in your information and it'll tell you if you're eligible for things or not. Very easy to use.
Thank you, Nancy. Thank you. One more thing, let me once again so introduce you guys. So we have amongst us Consul General of Pakistan, Aisha Ali. She joined us and she will be discussing the issues we have within our Pakistani community. Every community, they have their own issues. And I will bring her in later. And before we moving forward, I would like to introduce our panelists. We have Mr. Nadeem Qureshi. Within our Muslim community, we have an issue right now about the burial. How we're going to bury them, how we're going to give them a shower, which is called ghusl in our language. This is the major problem, and we never seen this in our decades of in our lives. This is the first time in the history that Muslims seeing that they can bury their loved ones without even giving them a shower. So this is for that reason we have bring us and one more time, we have a corona patient. He has currently 70 patients. He was talking before. I will bring him in. We have a Governor Lejan, Deborah with us, and she was talking before. We will get some points clear after this. We're going to have a Q&A session, and we have thank you very much for our congressman. He joined us from Washington, and he was discussing and showing. Among us, we have one of a CPA, Deepak Malhotra. He will be discussing about what other options available for our community to take the advantage in this crisis situation. Nancy Pinkin, our county legislator, Anwar Qureshi from Sunrise Diagnostic. We have Shanti Nara. She's our county legislator. She works in human services and safety, and she's a very active member of our community. She always there for the community. So let me go back to, we have a Nosheen Jaffrey from Pakistan. She's doing a lot of community service. I will request her to share her experience, what they're facing, what they're doing. Nosheen, can you hear me?
Yes, I can. So hello, everyone. Good morning from my side and good evening to all of you who are in the evening time now. So I'm very happy to be part of this forum. It brings a lot of visibility in terms of what global communities are doing. what you guys are facing in US. In Pakistan, I'll just brief you on the topic in terms of how big the issue is right now. So we are a population of around 220 million people, not very literate in terms of our rural population. So overall, the literacy rate would be around 24%, which means not many people are even aware of what the issue is about. And just telling them on the basics in terms of hygiene and educating them on how they have to take their care is a big issue in itself to begin with. So if I talk about the numbers, so overall, the positive cases which have been diagnosed in Pakistan for COVID-19 are around 7,000. The people who have been tested so far is 80,000, which means out of 210 million population, only 80,000 tests have been conducted so far. Yes, one of the biggest issues we are facing in Pakistan is our quantum of testing which we are doing on the daily basis. So roughly on daily basis, we are now capable to do 6,000 plus tests, but we started really, from hundreds, and now we have reached 6,000 plus tests, which is a good progress. The very good thing is that government is taking it very seriously. They are educating people. They are making sure every nook and corner that people are aware of the fact that it is not something which they have ever seen in their life, and they need to be very, very conscious about it. So as we speak, I sit in Lahore, which is the federal capital of the province of Punjab, the most thickly populated province. We are in a lockdown phase till 30th of April. Like many other cities of Pakistan, there are, just like Nancy and other people mentioned, in terms of how they have, given breathing space to some of the industries and some of the areas. But still, I think it is a very tough lockdown situation, and people are really suffering. So as far as crunch is concerned, there's emotional crunch, there's an economic crunch, and there's, the biggest area which has suffered is the daily wager. Because of illiteracy and because of the joblessness in Pakistan, there are a lot of people who are dependent on their daily wages. They don't have savings. They don't know how the day would come up tomorrow. So they set up their day according to what they get to earn in that particular day. So if I talk about what my role has been so far, so as Sam mentioned earlier, I work for Nestle Pakistan. That's my full-time job, and like most of you, I'm working from home. So it becomes, it's a torture in itself, frankly speaking. But in the meantime, what I was able to recognize was that the village where I come from, that village has roughly 800 households, and most of the people are daily wagers. Lot of efforts are being done in cities, but what I realized that in the villages the effort is slow or staggered. That's why the target audience which I picked to help was my village to begin with, and then we have now mashallah expanded to the villages which are nearby our own village. So the frontline soldier in this case is my brother, my younger brother. So one of the tough decisions we took, that my mother and myself, we stay in Lahore, and he goes to our village and lives there for some time, stays there in our family home, and help people over there. So I was raising fund. It was my first time, frankly, and I've not done anything. I've not done anything of this quantum before. So I'm very happy to share that along with Pakistan American Council help, uh, and 90 other donors, which I was able to have through my friend circle. When I started, I thought that I would get at best 5-10 people contributing, and I'll be able to help 10-15 families. But I'm happy to report that I've covered more than 1,000 families as we speak, for 4 weeks of ration. So one ration bag, or the necessity bag I would call it for general public, um, has the value is around $45, and we have been collecting funds based on that particular amount. So now, the moving forward, the biggest challenge we have is our holy month of Ramzan is coming, and again, something which has not improved in terms of the daily wages is they going back to their workplaces. So now I'm raising fund to make sure that I refill these families, and I try to expand the scope as much as possible. So yeah, I think one of the panelists talked initially about hope, that we should give hope to people. I think that is very powerful word, because if you don't give hope and you do not tell them, or you do not help them seeing the good side of the picture, that people are recovering, the government is trying their best, and they need to contribute to the effort, which means they need to stay home because it matters not only for them but all of the community. I think these are few things which I would like to encourage everybody talk around in their families and in their friend circle, and this is how we can have this snowball effect moving forward. So yeah, that's all from my side. If you have any questions, I can take them.
I was mute, sorry. Thank you. Thank you. I will go to now Dr. Zubair again. We started conversating in the beginnings. Now I think everyone is watching. Dr. Zubair, would you like to shed some points of what's happening and what can we do as a community and what is your role in this situation?
Thank you, Sam, and also want to thank the community and all the panelists who are giving us time today. Just going back a little bit with the background, coronavirus 2019 is a corona family which is discovered this virus particularly in corona family in 2019. That's why name is COVID-19. So this is new to the community, new to the patient, new to the physician, and then new to the whole world. Being this virus new, we do not know enough about this virus. And this virus is very communicable. And that's why we're seeing the devastating result of it. I think going back in January and February, we were very relaxed, did not get to bottom of it, that what's going on in China and then what was happening in Europe. And as a physician, I can tell you, we did not learn much from the China and European experience, especially how to deal with patient. First 4 weeks in America, we were doing things what Chinese and European experience was, and I can tell you that we didn't get anywhere. Now, we decided as a clinician that we're doing and treating these patients the way we think these patients should be treated. Yes, there's no cure at this time, but we do supportive care and help this community. I want to stress a few things to the community is how we can beat this virus or stay ahead of this virus. Why the governmental office and the community leader is urging the community to stay home so we can really stay ahead of this virus. By not communicating and stop the spread of this virus. That's the only way at this time we can beat the virus, because as I said, there's no immunization and there's no antiviral medication at this time we have. Imagine the patient when they come to the hospital with the full-blown symptoms, then if you don't have the treatment, you don't have anything to treat with, what will happen to the patient. I hear again and again the hope. I think hope is there, which we as a community already proven that if we can stay isolated, quarantine people who are positive, we can bend the curve. Curve bending is a kind of very important word. As a clinician, I can tell you, we were getting admission 50 to 70 patients a day, half of them ending up in intensive care unit. There's no enough intensive care bed in the hospital or even medical surgical bed in the hospital. Imagine if we go to the level where there's no bed in the hospital and the patients who are sick cannot breathe, we just close the doors on them. Imagine how it will feel to the community and what will happen. Our hands are up against this virus. And I think leadership, especially in New Jersey, Governor Phil Murphy, by taking certain community part and talking to the community and isolating them, we were able to really get to the peak and curving that peak a little bit Yes, there's still a lot of patients coming to the hospital, still a lot of people going to ICU. People who were admitted 10 days or 12 days ago, many of them are dying. Mortality in that population is very high who ends up in the hospital. That's what I see. I see people who are admitted in the hospital. Those are the people, that's 10% people out of the 100 patients who are affected, 10% who end up in the hospital, mortality in that population go up to 4 to 5%. And that's devastating. So what we can do, quarantine ourselves, stay at home, try to avoid crowded. So other thing which I want to bring to the attention to the community is where we get who we get affected from. It's mostly people we know. We don't get this infection from strangers. Right now in New Jersey, cases happening at your work, at your home, at your relative's family. Who bring it to you? People from New York who are working abroad, people who are on front line working, people who are healthcare. There's almost 9,000 healthcare people are affected right now.
Dr. I'm going to stop you there because I need to get some other people in. There's so many people in. Thank you very much, Dr. We will get you back if time allow us. Congressman, are you still there?
I'm here, and I looked it up while Dr. Zubair was talking. I have the website, if you want, for SNAP that you can apply online or ask, get some information about the benefits if you just want me to read it. You want me to read it?
Yeah, sure. SNAP? Please.
This is the state website. It's nj.gov/human-services/NJ-SNAP. So nj.gov/human-services/NJ-SNAP. And if you go on that, you can actually fill out the application online and it'll give you the eligibility for it.
Thank you, Congressman. Congressman, I have a question just came in that people saying that looks like today we have almost 750,000 people are most likely positive. And it doesn't seem like it's going to go away within weeks. It's going to take time. So whatever the fund we receiving, the people, single family, the or married couple, they're getting $2,400. So in case if things get worse, so is there anything else in the pipeline for the future? Because this $1,200 people, the money is not going to help. Number one. The second question was that there's so many subcontractors. This country built on small businesses, some moms and pops stores, some of the small men, because I'm a general contractor, I'm a builder, I deal with so many subcontractors with their cash, they have a lot of dealing in cash. They don't have a W-2, so they cannot go for PPP, so they cannot apply for that. So, and they have been working very hard. They're active members of the community, working diligently, working very hard for their monies. Are they going to get some kind of help from the government? And what's the plan for the future if things get out of control?
Well, you're asking a lot, and so I'll try to be talk in general terms. But I think that really, if people have individual problems, they have to contact my office because it's hard to be answer your question in general terms, Sam. But what I would say is this: whatever I talked about, whether it was the cash assistance, whether it was the food stamps, whether it was the hospital fund that doctors can provide for, whether it's the small business loans, which are forgivable loans, all these things as they run out, our intention is to refill them. So we expect that the SBA money will be refilled and people can apply again. We're hopeful that there will be another cash benefit. SNAP keeps being refilled. So all these things, if you hear that they're running out or someone says, needs more, they can always call us and we'll look into it. And I do believe that Congress will continue if this continues unabated, and we're going to try to, renew these funds. But I'm telling you what exists now. I can't promise, what might happen in 2 or 3 weeks because, Congress has to pass the bill, appropriate the money, and that has to be Democrats and Republicans from all over the country. But I don't want anybody to think that, just because what I'm talking about today is not sufficient, that we're not going to continue to try to provide more money into these various programs. Now, when you talk about a contractor you're saying somebody who's like totally off the books and doesn't pay taxes or anything? Is that what you're saying?
They do pay taxes, but as far as the payroll taxes, they have like cash. A lot of employees, basically Mexican communities and Hispanic communities. They have.
Well, I mean, look, I got to be honest with you. This Trump administration, as you know, is not willing. And I mean, I know I'm not supposed to be political here, but the bottom line is, the Trump administration and a lot of the people who are associated with him are not looking to help the people that are undocumented. And so that will be a problem. Now, it's not a problem in terms of their health care, because, as I said, if they want to have a test they can go and have the test, they can go to the hospital, they can go to a doctor, and that will be reimbursed. And I'm hoping that, down the line, we're going to be able to extend that free testing to free treatment and to free drugs and vaccines and the whole thing, because we're all in this together. And we shouldn't differentiate people because they're undocumented. The virus is not looking at whether you're documented or not, or whether you're a millionaire or you're a pauper. That's not the way healthcare works. As doctors are bearing all of us know. But right now, in terms of healthcare for somebody who's undocumented, look, go and get the test, go to the hospital, the emergency room if you have to, go to the community health center. The Chandler there's the community health center in New Brunswick, the Rutgers one. These are all facilities you can go and have tests, and you can get treatment. We don't want anybody to not go and take the test or not get treatment because they're undocumented. But in terms of cash assistance or help through these various programs like the SBA, the cash assistance, the unemployment insurance, no, they're not going to be eligible if they're undocumented. That's the problem. And I, as a Democrat, I would support expanding a lot of things to the undocumented, but it's not the case. It's not the law.
Thank you, Congressman. Thank you. I will take, I know we're getting late now. I will request, as I earlier introduced, we have among us a Council Journal of Pakistan in New York. Her name is Aisha Ali, and she wants to join the event, this webinar and discuss what the Pakistani community facing in the tri-state area. Please, Council.
Good evening, everyone. Thank you, Sam, for this opportunity. I'm very happy to be joining your webinar. I thank you for the wonderful work that you and your organization are doing for the community. It's really very, very commendable in terms of, going out there and distributing food and helping people in every possible way. Thank you also to all the participants. I think it has been an extremely informative session for me as a Consul General, because in our community, in the Pakistani American community, obviously, in the tri-state area, people have been impacted by this disease like the other communities, and people's livelihoods and their economic lives and their jobs have been affected by it. So very important, some very important issues are being raised here today, and I'm very grateful to everyone who has participated and shared information. I think as we deal with this pandemic and as we are, sort of incarcerated in our homes because we cannot go out, it is very important that whatever information we have, it needs to be shared. So thank you to all for sharing the information, particularly in regards to the economic situation and to the stimulus package. From the Consulates Forum, I also wanted to highlight a couple of steps that we have taken during the pandemic and in order to keep our community informed. So right from the beginning, when we started seeing the first cases and as we were becoming aware of the situation developing, I think the Consulate General has been very, very active in disseminating information and in making people aware of the guidelines that were coming out from the World Health Organization, as well as from the local and the state governments. So in the first phase, I guess that was very important. And since the Consulate General of Pakistan, New York, has a very large jurisdiction, and we deal with a very large community of Pakistani Americans, we have been extremely proactive in trying to help and to coordinate our efforts with the community organizations and to help our community as much as possible. So here, for everyone who is listening to this webinar, I want to highlight a number of steps that we have taken especially to deal with this situation. We have, for everyone, I want to tell you, a 24/7 emergency helpline at the consulate. So anyone who needs any information or needs any help from the consulate, we are available 24/7 to respond to your queries. We have designated a special focal person and a special team to address people's concerns, whether it is related to COVID itself or whether it is related to the situation resulting from it. Here, I would also like to share that we have a number of our Pakistani citizens who are also stranded in the consular jurisdiction as a result of the suspension of flights to Pakistan. So anyone who is listening to me and needs help and any assistance in regards to that, we are available to provide all sorts of assistance to our citizens. And our information is available on our website, our phone numbers, our email addresses, how to get to us through social media, Facebook, and all other social media platforms. We continue to offer all our consular services to our community online. So whether it's passport, visa, whether it is their national identification cards or any other consular service, it is still available online, and you are all requested, if you need, to get in touch with us online for those issues. We have been extremely proactive in the last couple of weeks to ensure that our communication with our community remains really updated, and we're active. We reach out to our community through our direct phone calls. I have myself sent out several emails, written letters, as well as recorded messages in order to address the needs and concerns of the community. We have also reached out to the families that are affected by COVID-19 and any assistance that they need in regards to the burial of their loved ones or repatriation, in some cases, of the dead bodies. We are there to assist you and to help you. We will offer support for funeral expenses if required. And in our larger reach out to the community, I am holding very regular town halls online through Zoom and other services, so that we keep informing our community of the important issues that they are facing in this situation, including the economic situation, as well as how to deal with the stress and economic and emotional stress. We are being helped in our efforts a great deal by several Pakistani American organizations and community leaders. Sam Khan, I'm very grateful to you for all your efforts and for all your assistance to the consulate. And if anyone is listening to me and needs any assistance, you have all our information. And I would request you also, Sam Khan, that if somebody approaches you, if you could kindly guide them. We are available, we are working, and we're working around the clock to help our community. Thank you so much for this.
Thank you very much, Aisha Ali. the Council General of Pakistan. She was explaining what's the situation within the Pakistani community. And there's a one journal, as Frank Plone, Congressman, said, this corona doesn't discriminate against. We all discriminate against each other, but this guy does not. So I have people here. Sunil Hali is one of journalists and from the Indian community. We have a Deepak Malhotra with us, and he will be expressing some. He will be mentioning some what the government is doing when as the finance comes to the community. How can they can improve their situation currently they are facing due to this COVID-19. Deepak Malhotra Saab, he is a CPA. Please come on and speak.
Thank you, Sam Bhai. It's an honor to be here, and thank you so much for hard work, all those frontline doctors, and thank you, Congressman Frank Pallone, Ms. Penkin, and all the leaders of the community, Shanti Narat, for doing all the every great thing for the community. I'm not going to take that much of time, but Sam, thank you for making me part of this great program and all the things that you have been doing for the community. So the government, as Congressman Pallone mentioned, that we have some economic impact payment from the government EIP stimulus checks. It already has been deposited on some of the accounts, $1,200 for each individuals, and there's the income limit for $75,000 for single, and married filing jointly is $150,000. And it completely phased out when somebody makes $198,000 or more. So 150 to 198, they're getting some payment, but not actually 2,400 for like married filing jointly, getting a little bit lower. And also for each dependent children, they're getting $500 for each dependent qualifying dependent. So the qualifying children has to be 17 years or younger. So there are some miscommunication going on. There people are panicking, but and the checks are being deposited slowly. The other thing also I want to advise everyone here: if somebody is not eligible on 2018, but they are eligible on 2019, so just make sure they file their return as soon as possible so they can get the stimulus payment or the same 2,400 for married filing jointly and 1,200 for single. And anybody who is not eligible on 18 and 19, they can still get in 2020 when they file 2020 return on 2021. So that's another thing, but that's not basically anything. But there are a lot of credits, and I also gonna cover in short, not too much. There are student loan payment has been deferred, totally stopped. The government is not collecting the self-employed sick leave credits. It's a huge benefit for self-employment people. There's up to $10,000, $5,110 maximum credit if somebody is self-employed and they are staying home and if they get affected with COVID-19. And there's also 2,000 credit for if somebody's self-employed and they're taking care of the child at home. So there are a lot of good credits available, but that's not a cash program now that anybody can get advantage, but eventually, yes. And the net operating loss, NOL, for corporation also can carry it back for 5 years and also can carry it forward now 100%. That's for only C corporation if anybody has it. For self-employed, I'm sure the PPP loan and then EIDL, most of the people now know that, as Congressman Pallone mentioned, they ran out of the money. And thank you for all doing, Congressman Pallone, to get this another funding. Is sure it's going to be there. So just to let you know, guys, it's a great program. Just talk to your banker, apply for it. SBA is on, kind of a very helpful on those things. So just please make sure your paper's ready. It's basically forgiven for the people as long as you have a 75% of the payroll on the money that you borrow from them. There are two separate programs, by the way. You can apply for both. Some people say, hey, you cannot apply for EIDL and also PPP, but you can apply for both. What will happen eventually that if you get EIDL, that's a non-forgivable. But if you have employees, eventually you can transfer that portion to a PPP program, and that can be forgiven. The EIDL has 30-year payback, and the PPP is only 2 years, but the loan interest rate is only 1%. if any money that are non-forgivable. So these are the great benefits. I would be happy to help. By the way, other things also people will confuse. Let's say somebody has a parent or any dependent who are not filing the tax returns. They can go online in IRS website and they can register that they are not filing the return. They can still get that EIP payment, like a stimulus, $1,200 each, to their mailbox or bank account they can fill out. If somebody doesn't know, I can definitely help. In my also company website, I have that link. You can click it and then you can register your name that I am not filing 2018 and 2019 return, and you can be eligible for $1,200 payment for that. And as I said, there are a lot of other credits you could be eligible, and I would be happy to help. And Sam, thank you. And let me know if anybody has any question. I would happy to answer if any way I could. Yeah, I cannot hear you, Sam. Bhai.
I think we have passed our time limit, but I think this is very interesting. There's very interesting topics. And there was a very important issue within the Pakistani Muslim community, not only the Pakistani community, Muslim community. We having issues with the how to bury a dead body, which is corona positive and expired in the hospital of due to corona. We have with us Mr. Dr. Nadeem Qureshi. He's owner of a park funeral home. So I would like request him to, Mr. Nadeem, can say a few things in very short 3 minutes time. Thank you. You have a mute actually. You have mute your, you have to unmute yourself.
Sam, can I say something while we're waiting for him?
Sure, sure, sure.
I just want to say two important things. One is while we've been socially distancing, we still have to do the census, and it's very important for us to get funding back to New Jersey and to get funding for all the healthcare and the other services that we're providing for people to fill out the census. So you should have found something in there, or go to 2020census.gov. And the other thing, really quick, is that the primary election has been moved to July 7th.
Thank you, Nancy. And I'm gonna, I think you have to fix your, the mute button. I will take Tahir Raja. He's another organization who buries, if somebody dies and they don't have a funds, they bury, they donate and they collect the money from the community, and they're doing a great job. Please, Tahir bhai, quick, if you can just in 3 minutes. And you have a mute problem. Yeah, now you're good.
Yeah, Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, everybody. This is I'm pleased to join this forum. It's an honor for me from Pakistani community to represent my organization. So briefly, I will touch upon. I'm president One Nation Us. One Nation Us is basically a non-profit organization, and a lot of people were talking about the hope and the community getting together. And we don't know how to fund anybody who's a needy case. So here's my organization doing the same. We have more than 180 volunteers on the list, and all members are basically volunteers, and they give their time and to the community. We are helping the community since last 5 years. And there are so many other projects we are running, but I'm not going to talk about that. I'm going to just talk about the funerals, which is an epidemic right now. So when a call comes, when unfortunately somebody dies, they call us. So we take the call, and if that family can pay the charges for their funeral, we assist them. We technically assist them, we guide them step by step, because seriously, when somebody dies at home or in the hospital, people don't know what to do. So we help them and we guide them, and we facilitate whole the process. But second and most important thing comes up then when somebody cannot pay the charges and there is a funeral now. So what to do now? So here comes the One Nation Us. When they call us, we ask them, are you going to pay? Or you cannot pay? So our evaluation committee, we have an evaluation committee, we evaluate the case and decide, yes, we're going to help it. So there's no worries for that family. We raise our funds from our own members. We have a group of WhatsApp, and we raise the money within our group. And I told you, we have more than 180 members. Believe me, it takes minutes. And once we were talking about the positive things during this is one of the positive things that One Nation is doing, that in minutes we get the money. People have come together. People have gone more sensitive, and people are more willing to work together and help each other. So here is One Nation. So whenever there is anybody like that, we fund that funeral. And one more thing I will tell you, that One Nation does not accept any surplus on the donations. The moment, for example, we need $2,000 for that funeral, we just raised $2,000. And after that, it stops. And that money goes directly to the funeral home who is doing that burial. So I would suggest, I would rather tell everybody, I would tell Aisha Ali, the Consul General of Pakistan, we've been working with them actually. And we want, if there is any case, Nancy, you were talking about that we don't know how to support those families. So here we are. Take my number. One Nation Us number is 347-770 One Nation Us, ONUS, and that becomes 6687. So please write down this number. Anybody in this community needs help, we are open. We have a 24 hours call number. We have our.
Thank you very much, Tahir Bhai. Thank you very much. Deborah, I think is getting late, so we're going to wind up. If you want to say a few words, end of this.
Can I just ask, Sam, did we find the answer about how the body preparation is being handled now?
Yeah, actually, problem is Nadeem Bhai, he having a trouble with this mic situation. So I don't know. He's the one, the funeral guy. So I don't know.
Sam, can I add on to this one, please? Can I answer, Nancy?
Yeah, go ahead. Go ahead.
Nancy, there are two cases. One is doctor is sitting with us, Dr. Zubair. He knows better. There are two types of cases. One, that some person dies in the hospital, and the second case is when somebody dies at the home. So in the hospital, the case is very clear. Doctors sign the death certificate. They wrap the body into the bag. And then when funeral guys go, funeral doctors go, they pick up the body.
Okay, so I'm gonna take, because Nadeem Quraish, he is on. So
All
please,
right.
Nadeem Bhai.
Okay, thank you very much for inviting me for participating in this informative webinar. I just want to let you know that Muslim funeral is very simple, but it is a little different from the other communities. And our procedure is that we start after having a person die, we remove the body and bring it to the funeral home. We need to wash the body, and after this we have a quick short prayers called janaza, and then we go to the burial procedure, into the cemeteries. So this is something very simple, but at the same time it is very mandatory for some people from the community, even if they are not relative to the decedent. They have to participate, and this is called farz-e kafaya. Someone need to make this funeral services for the decedent, and after this, has to be also very quick. So that's something make our community very panic, especially in this situation, because we have to be very quick and we have to do all this, and we have to really participate. This is part of our religion. Now, in COVID-19 pandemic phobia, we're having a lot of backup from hospitals for removal to the funeral home to cemetery. Everyone is backed up right now. Families are very, very panicked in this situation. We are receiving 2 to 3 cases Muslim from New Jersey right now. I'm also having New York funeral home services, and we are having over there a lot more. But in New Jersey, we are having 2 to 3 cases per day. And at the same time, I want to advise everyone, please do not get panic at this moment. Everyone needs time. Let them to work, because we have to get the burial permits. We have to get all the EDRS permissions. Otherwise, we cannot make this burial. And at the same time, there are many agents who are working right now in the community, and they are collecting cash. I like very much careful, because if they collect the cash, you cannot follow them. You cannot get the services accordingly, because they are not funeral homes. So we need to really contact the proper facilities, funeral homes, like we have a Park Funeral Home, and pay with the credit card. Don't pay with the cash. This is something I really want to stress. And at the same time, when we are coming for the funeral services, we have to maintain social distancing, because we don't want to spread this disease, because COVID positive families, and we have a washing, we have a janaza, we have burial, but we need to also have social distancing. For any need, I will really like to call our number 718-418-7225, or go to our website parkfuneral.com. Any question, I will be very happy to answer.
Thank you very much. I think we're gonna just wind up the.
Yeah, Sam, can I
yes,
just say two quick
I was
little
coming to
things?
you. Yes, yes. Go
Yeah,
ahead.
just two quick things. I just wanted to tell everybody, Middlesex County, we're the only place in the country, and I think we're the only place in the nation that started a spit test. So it is not the swabs, it's a spit test. It's much safer for the people coming to have the test, as well as the workers who are administrating it. And the results come within 24 to 36 hours. So we just started it this past Wednesday. We'll be doing it 3 days a week, Monday, Wednesday, and Friday, in both Edison and in South Brunswick in Middlesex County. Unfortunately, right now you have to be a Middlesex County resident, but we're hoping that as this test, we start doing this more and more, we can work with our partners in Middlesex to spread it around the state. And the second thing I want to say is there are a lot of people in our community who are medical professionals. And one thing that happened today that Deborah didn't get a chance to mention is the governor did something that we're the only state in the country that's doing, where they are going through a process where they're going to grant foreign doctors emergency doctor's licenses in an expedited fashion, so they can join in the fight against this disease and helping our community members. So that's just something that if there are people out in the community that you know who were doctors in Pakistan or anywhere else, and they're here and they haven't been able to practice, they can apply to the New Jersey government website and see if they can qualify for this emergency license. That's it.
They also provided protection from medical malpractice with this as well for the doctors that would want to come forward.
I just want to add something that Medicaid also pay for Medicaid recipients for the funeral cost. So funeral homes can also bill to Medicaid.
Back to you, Sam.
Deborah, you want to say something?
Sam, I just want to thank you and everybody who's participated this Friday evening. I see you've had a lot of people stay and listen in and chime in with questions. This is one of the most important things that we can do right now, is come together to share information, to support each other, to learn more about ways we can help and places we can access help. Everything that we have done that has disrupted lives, we're trying to do as many things as we can to help people's lives. So the partnership will continue. On behalf of Governor Murphy, we see that we have great representation from the community, from the state legislature, from the county here, and we're all here to work together to help people through New Jersey through this crisis. Doing it together, we know we will. And Sam and Dr. Zubair, this kind of event is exactly what really helps. So thank you all very much.
Thank you. If Congressman is still here, if you last minute, we're going to end this now. If you want to say something.
No, thank you, Sam, and thank you to Dr. Zubair. But please don't hesitate to contact us for any of these questions. I really appreciate the fact that Sam and Dr. Zubair did this tonight. But don't hesitate. We're here, and even though the offices are not open to walk in, you can contact us on the phone or through social media. Thank you, Sam.
Thank you very much. I think we're going to be continuing this. We're going to try to do within the next 10 days again. And we will bring other expertise and other government officials to share, and maybe the things being changes. I hope things get better by the time next week or 2 weeks. And what I'm going to say towards the end, the community is going through a crisis, and we need to, our resources, put it together. Like PP, if we don't have a mask, our Pakistan American Council, Dr. Zubair, I have 2,000 masks sitting in my car just for donating right now. So I think from the Sunrise Diagnostic, they donated, I think, 30,000 masks to the governor. So we as a community, we working to even help lend our resources, lend our services to the officials, to the government, so they can resolve the situation. This is a grave situation. This is not a regional situation. This is a global situation. This is not just a pandemic. This is a situation we can turn the economy into depression. We already going through, you see our stock market, you see how many people applying for unemployment. So this is not an easy time on a government as well. So they're trying to help you, but you have to see where the economy is not working, where the people are not working, they're not collecting taxes, they are actually so many stuff going through. And our governor is every day on radio and TV, and he's talking about how can we, and towards the end, what I'm going to request everyone who is listening to this webinar is stay home. Don't be smart, and don't try to do something stupid. Sorry to say, but this is threatening. If you go out there and one single event can bring you the corona in your home, your kid, your family, your older parents, they can get it. So be careful out there. Whatever you can do to help the community. It is hard time to help the community, but we are doing ourselves. People like me, there's so many people like me who are doing good work for the community. Once again, thank you, all of you. Nancy Pinkin, our state legislator, Council General of Pakistan, Aisha Ali, Shanti Nara, the county legislator, Nausheen Jaffrey from Pakistan, she's doing a great service. Tahir Raja Saab from One Nation, Deepak Malhotra, one of our CPA, is a community activist. He ran for assembly before. Deborah, I always forget her last name, but Deborah. So we have so many other people. Once again, we will wind this up. Thank you, all of you. Stay safe and lend your hand to help others. Thank you very much.
Thank you, everybody.
Thank you.
Thank you. Bye-bye.
Thank you.